because I had already been to Cuba before and I knew their health system, when I was appointed to be Minister of Health, I wanted to transform the health service in South Africa, which was very apartheid. There were many departments of health, according to your color, according to where you lived. So I wanted to transform that. But also, people expected a better health service once 94 came. So, but the doctors we had didn't either want to work in the rural areas. The rural areas were hardly serviced by doctors. So I decided that let me go to Cuba and see what help I can get from there. And asked if they could send doctors to come and work in South Africa. And Cuba was very willing, but South Africa was not. The medical council then said no, they can't have Cuban doctors in South Africa. And I said, why? They said, no, we don't even know how they are trained. So I said to them, okay, give me 10 professors of your choice. I'll take them to Cuba with me. And then when we come back, they must tell me why we can't have Cuban doctors. So indeed, they chose 10 professors of their choice. I went with them to Cuba. They studied the Cuban health system, the curriculum, everything. And President Fidel also met us. And he told them about health research that was happening in different countries that they didn't even know about, because he was very passionate about education and health. He knew everything about health and education across the world. So when we came back, they said to the medical council, Cuban doctors can come. So now South Africa was willing to have some Cuban doctors. But the medical council was still not completely convinced. So they said, no, before we accept them, we have to interview them. So I thought, sure, Cubans won't accept this, their doctors being interviewed. So I spoke to the Cubans. The Cubans said, fine, because we want to help you. They can be interviewed. So we received Cuban doctors here. I remember going to the airport and the flight arriving. It was so exciting. And we had more than 300 doctors coming to South Africa. But then I thought, we can't always rely on Cuban doctors. But our medical schools are not producing enough doctors. And when they do produce them, they produce doctors who want to go and work in Canada, in the US, and don't necessarily want to work in South Africa. So then I said, let me have another layer of cooperation with the Cubans. I asked them if they could accept students from South Africa to study medicine in Cuba, who would study in a system that will train them to work where they are needed. And indeed, Cuba agreed. And but unfortunately, at the time, the way South African government worked, it was the provinces that had to send people. National could only just say, this is the policy, this is what is available, but it was the provinces. And unfortunately, only one province took the call, and they only sent 10 students. Then Fidel came here for the non-aligned movement, and then had a meeting with us. And he said to me, now I understand why there were 10 students. When I first heard that you had sent 10 students, I said, If you were my Minister of Health, I would have sacked you. Because how long will it take you to replace just the Cuban doctors who are there if you send 10 a year? He said, but I then didn't believe that you could do something like that yourself. But now I understand it's the provinces. And then he said something he said, I hear the problem is money. You see, money is a problem. Because in Cuba we don't have money, we don't have a problem educating our children. But you, because you have money, you have a problem. And then he eventually said, you can send your students, even if you don't pay, just give them pocket money, which was very embarrassing. But eventually we got more and more students to go to Cuba. And now we have more than 3,000 doctors trained by the Cuban government who are working in South Africa. So, but it wasn't just about the personnel, it was also about the system itself. Because the Cuban system, we're not there yet, but it is based on primary health care. In Cuba, every citizen has a doctor assigned to them. So we're not there yet, but at least we adopted the primary health care where we have clinics where people can go near where they live and also be seen by doctors, because before all the clinics in the rural areas only had nurses, no doctors. So the Cuban system influenced us quite a lot in that first 5 years of democracy.
Fidel asks in public to Mandela, he goes, okay, how long do you need the doctors? And then they discuss, well, let's see, maybe a period of time. And then Fidel says, no, the Cuban doctors can remain there forever. And that is something that was very unique, because Cuba has always had good collaboration programs with many countries in the world, in Africa, in Latin America, in many places. But it was always on a base of what you need until when, and then we send more, we bring more, or things like that. But he decided that South Africa had to be different, had to have a different approach. And we are actually this year commemorating the 30th anniversary of that first doctors that arrived in South Africa in February 1996. But what it tells you is that that basic relationship between both leaders was the one who made all this available.
Can I just talk about how Fidel and Mandela saved one of the medical schools in this country? The medical school in Mthatha was having problems with lecturers because people wanted that medical school to go to East London or PE and not be in Mthatha. So I said, no, I'm going to go to Cuba and see what can be done. So I took the dean there. We went with Mazwai to Cuba and said, now we don't need doctors, we need professors who are going to teach medical students. And Cuba, without hesitation, they said, okay, how many? He said 25. They said, okay, you'll have your 25 professors.
They're still there.
So that's how it was that medical school was rescued by the Cuban professors. Otherwise, it would have been closed. So that's how strongly Cuba influenced the direction of a democratic South Africa through its lived solidarity, not pronounced. Because when the first Cuban doctors came, there was a lot of resistance, even from some communities, especially the white communities. But one day, a white mother put out an article to say her child was treated by a Cuban doctor in a hospital, and she saw something she's never seen. When the child was discharged, a few days later, the Cuban doctor arrived at home to check how the child is doing. And he said, I've never seen it in South Africa, ever. And he was right. She was right. And then stories like that started turning the tide in terms of how people viewed Cuban doctors. So they are trained differently. But it's not just the training, it's their philosophy, the philosophy of Cuba itself towards human beings that influences